All right, so we are in the week of November 2nd through the 5th. Can you believe it's November already? So we are getting ready to get going with the respiratory system and the digestive system. So I haven't finished grading practical 3. Hopefully I'll go over that on Wednesday with you. All right, that's what we're going over this week. So, all righty. So let's go to the study guide, or start with respiratory system. So we want you to be able to know different parts of the respiratory system. So I can't guarantee it'll be this picture, but I can guarantee you're going to see a picture on your practical that you're going to have to, it'll have letters and you'll have to say which structure that is. Okay. So get very familiar with this chart. So, all right. So if you're inhaling through your nose, air is going through your nostrils into your nasal cavity. Okay. All right. So then you're going to have air go down through your pharynx to your larynx. If you're breathing through your mouth, okay, air will go straight from your oral cavity to your larynx. Okay. And then to your trachea. And then you'll have this main bronchi, left and right. They'll go to the left and right lungs. So this is your right lung, this is your left lung. How you can tell the difference, obviously from the patient's standpoint, this is the patient's right. The other way you can tell the difference is the right lung has 3 lobes. Okay, left lung has 2 lobes. All right, this muscle here that helps with breathing is the diaphragm. Okay, so those are structures that you need to know. All right. All right. More structures. Okay, so you've got the nasal conch or conche, superior, middle, and inferior up here. Okay, so when we were looking at the skull, sometimes in some of the views you could see the conche. Okay, but this is generally where they are. Okay, so superior, middle, inferior. Okay, so these different folds here: superior, middle, inferior. All right, again, here's your nostril. Here's your oral cavity. Big muscle is your tongue, right? The structure that kind of flap in the back of your mouth is your uvula, okay? And then you've got the tonsils, okay? Some of you may have had those removed by a dentist growing up or with your kids. All right. This flap down here is the epiglottis, okay? This flap here is the vocal fold, okay? Helps you with your making your voice resonate. Okay? And you have these 2 passageways. Passageway for food is the esophagus. Passageway for air is the trachea. Okay. So those are parts of the upper respiratory tract. All right. So once air gets into your lungs, it goes into from bronchi to bronchioles, and then to alveolar ducts, and then to alveoli. So the individual little sacs, okay, the individual ones, we call these alveoli. That's plural, and the individual one is an alveolus with US at the end. This whole kind of branch, like a bunch of grapes, like a whole bunch of grapes would be an alveolar sac, okay? Now, one of the things you're going to have to know are lung volumes and capacities. All right, so let's talk about this. So the normal amount of air that you inhale and exhale, that's your tidal volume, okay? So that's your normal inhalation and exhalation, okay? Inhalation is kind of going up the curve, and exhalation is going down, or expiration is going down. Again, we're measuring this in milliliters. Now, the inspiratory reserve volume is how much you could actually breathe in after a normal inhalation. So if you just breathe in like you would normally, and then you breathe in more, as much as you can breathe in, that's your inspiratory reserve volume, and that's around 3 liters or 3.1 milliliters. Okay. Now, after a normal expiration or exhalation, you have your expiratory reserve volume, which is how much air you can exhale after a normal exhalation. So you exhale, and then you push out as much as you can. That's your expiratory reserve volume, okay? Around 1.2 milliliters or 1.2 liters. Now, the air that's left in your lungs, they don't completely collapse, okay? You still have some air that's still left in your lungs after you pushed out as much as you can. That's your residual volume. That's the residue, what's left, okay? Now, your vital capacity, that is actually, you think about it, that's the total amount of air that you can bring in or push out, okay? That's, if you add all of these together, your inspiratory reserve volume, your tidal volume, and your expiratory reserve volume, that is about 4.8 liters, okay? So you'll probably see at some point, a picture where you have to identify one of these, at least one, okay? All right, so just want you to be aware of that, all right? But again, just to kind of review, I'm going to kind of draw lines. All right. And I'll type. So your tidal volume. Respiratory reserve volume is your air exhaled after normal expiration or exhalation. Your residual volume is air remaining after forced expiration. So that's what these different terms mean, okay? All right. All right. So we're gonna put that down. All right. Minimize that. All right. So I'm going to pause here. I'm gonna allow you to discuss these different lung volumes and capacities with your partner, as well as some of the different structures. Okay, and you can do this at home as well. So we do have a few slides. We do want you to kind of know the difference if you see them. So again, trachea, okay, this is air goes into the trachea after you breathe it in through your pharynx, okay? Trachea's got some cartilage here, cartilage ring. So that's one of the ways you can tell this is the trachea, okay? Got a big opening for air and the cartilage ring. All right. So this is a slide of the lung, okay? This is part of what you're seeing are alveoli and capillaries, okay? So alveoli are kind of invisible, if that makes sense. And then you've also got little tiny capillaries, okay? And why do you think you have capillaries in your lungs? Right, for the oxygen to go in and your carbon dioxide to come out of your lungs, right? So gas exchange, nutrient exchange, okay? All right. So we're also going to look at the digestive system today. So just like we had to know organs in the respiratory system, we also have to know organs in the digestive system. So obviously, food typically enters your digestive system through your mouth. Okay, it is considered a digestive organ. All right, it's just mouth is your oral cavity. All right, you have a tongue. Okay, you have taste buds on your tongue. Okay, also helps kind of with mashing your food down, making chyme. All right, you've got salivary glands to help break down your food. Okay, you also you can see a bit of the pharynx. Okay, and then remember your air needs to go down into your trachea and your food needs to go into your esophagus. Okay, this is your esophagus. All right. And that's taking food down into your stomach. Okay. All right. So it has this sort of sac structure to it. Okay. So it sort of curves around, goes into the stomach. Okay. So food from the stomach then is going to be entered in down into these small intestines. Okay. And even though they're really long, they're small because they're not as wide as the large intestines. Okay. So they travel around your small intestines and a lot of food gets absorbed into your cardiovascular system there. Okay. Eventually, what's remained of your food and water is going to go into your large intestines. A lot of your water is absorbed at the large intestines. Okay. It has sort of an ascending and also sort of refer sometimes to the large intestines as the colon, right? So you heard of like colon cancer or colonoscopy, things like that. So this is the ascending colon, kind of transverse colon, descending colon. Okay, the essentially the area where you kind of before you have the opening at the anus, you also have the rectum. Okay, and that's sort of where you've got sphincters to control, basically keeping your feces from just coming out uncontrollably, right? So now you have this little accessory structure called the appendix, okay? Most of the time, doesn't really do too much, except if it gets inflamed, like if it gets feces caught in it, can cause problems. All right. You also have, okay, here's the pancreas. Okay, pancreas is also it is a digestive organ because it secretes digestive enzymes. It is also an endocrine organ, okay, because it secretes hormones like insulin, right? So, and then you also have the liver, okay, which is considered a digestive organ, helps to break down things, okay, detoxifies blood. You also have the gallbladder, okay. Bile typically is produced in the liver and stored in the gallbladder, and it can be released through your bile ducts into your digestive system to help you break down fats and other things. Okay, so this is an overview of the digestive system. Okay, some of your tables have digestive organs at your table, so you can look at. All right. You'll also, on the practical, need to be able to, in a quiz, be able to identify different kinds of teeth. Okay. So, again, this part of your mouth, or at the roof of your mouth, is your hard palate. Okay. Now, for your front teeth, we typically call those incisors, okay? And they typically are for, cutting, tearing apart food, okay? Okay, just lateral to the incisors are the cuspids, okay? And lateral to those, we have the bicuspids, and toward kind of lateral and posterior are your molars, okay? Molars are typically on the kind of the back of your mouth, all right? But typically, if you're going from the midline, you have incisors, cuspid, bicuspid, molars. Okay, and molars kind of have more of a flat, kind of bumpy shape, whereas the incisors kind of more pointed. Bicuspids start to get sort of a bumpy shape, but not nearly as large as your molars. And your cuspids are kind of pointed, but not nearly as pointed as your incisors. Okay. All right, let's talk a little about your stomach. So you may have thought of your stomach as just basically a place where food just gets dumped, but it's a little more complicated than that. All right, so essentially you have different layers, okay, to the stomach. So you have sort of a layer of muscle tissue, smooth muscle, okay, and that is, we call that the body of the stomach, okay. All right. Now on the internal lining of the stomach, we have all of these sort of ridges. We call those ridges rugae, okay? And they sort of help with increasing the surface area and the lining of the stomach, but also it kind of helps to create contact between the digestive enzymes in the stomach and the food, okay? So it also kind of helps to, especially when your stomach is contracting with the smooth muscle, helps to break up that food. Now, at the ending of your stomach going into the small intestine, there is a sphincter. And a sphincter is basically a ring of involuntary muscle, okay? And it controls food moving into the small intestine. Also kind of helps to, basically, you don't have just a rush of acid, because your stomach, as we'll learn as we in lecture, your stomach has a lot of digestive, or a lot of acid, okay, to break down your food. And you don't want all of that acid just, anytime running down into your small intestine. So it typically is going to stay closed while you're digesting your food, okay? And then when it's time to move your food out, it opens. Now, the other piece to that is keeping the sphincter closed gives your body a sense that your stomach is full, okay? Because if it was always open, food would always essentially just be falling into your small intestine, and you wouldn't, your stomach, when your stomach is full of food, it gives your body a sense that your body's full, okay? So that closing of that sphincter helps with that. But you definitely need to know the muscle, rugae, the lining, or sorry, the muscle, the body, the lining, rugae, and here the sphincters controlling exit of your bolus into the, which is basically a term for the food. And once it gets to this level, down into your small intestine, where it essentially becomes feces. All right, now this is a cross section of your esophagus. Okay, so in contrast to your trachea, you don't see like a big ring of cartilage. You don't see a big wide open space for air. Okay, so your esophagus has a lot of muscle, okay, to help move that food down to your stomach. Okay, so a lot of muscle. Okay, all right, the food's sort of moving into this, down through this space here in the middle. Okay, all right, here's a cross section of the stomach. Okay, so you've got a lot of little openings here. All right, And a lot of those openings have your hydrochloric acid. Also, sometimes you've got basically neutralizing substances to keep the lining of your lining of your stomach from getting eroded. Okay, so you have a lot of goblet cells which kind of help neutralize all of that stomach acid. Okay. All right, now on first glance, the small intestines might look similar to the stomach, but what I would say is you don't really have, the staining is a little different, number one. You don't really have this kind of layer of kind of circular, almost cuboidal type cells down here. You have a little bit of it, but not so much. Okay. But you have more, I think, defined ridges in the small intestines. And that's because the small intestines is where you absorb the majority of your food. So you want more surface area in your small intestines. Okay. All right. And I would also say in comparison, you have a lot less goblet cells in your small intestines than you do in your stomach, because you have other materials in your small intestines to counteract the acid that you see in the stomach. Okay. All right. Here's the large intestines. Again, lots of goblet cells. Okay. And but not as structured for absorption. So you don't really have big areas here to absorb nutrients in the middle. Okay. In the large intestines, you don't really have that structure. What you do have is a way to store water. Okay. So they're going to pull water out of your small intestine. Okay. So might not be the most interesting or coolest thing to talk about, but if your large intestine absorbs too much water, you get constipated. If your large intestine doesn't absorb enough water, you get diarrhea, right? So, all right. So, give you all a minute to talk about what you learned about the digestive system in terms of organs and microscope slides. And you can do this at home as well. And that concludes this week's discussion of the respiratory system and digestive system. All right, and we will see you in the next video.